Hello everyone, this is Dr. Sarosh Siddiqui from the platform of UKMLA with TSS. So let's just continue our ethical category, and the topic that we're going to discuss today is basically abuse. Okay, and this structure that I'm going to teach you today, it can be used in any type of abuse. It can be domestic abuse, it can be sexual abuse, it can be emotional or verbal abuse that a patient may be going through, but the patient wouldn't be in the category of the peds, or the patient wouldn't be an elderly. Okay, the pediatric group and the elderly group are the one which would present as non-accidental injury. Okay, and we've already discussed the structure and the format to deal with and to go about the non-accidental injury cases in the previous lecture. Okay, so you need to follow this approach for all the abuse cases except for the non-accidental injury. Okay, now let's just get into it, and let's just go through the structure that you need to follow in the abuse cases. Okay, so you can be in GP surgery, you can be in the A&E, and a patient would come to you with some concerns. Okay, and what can be the possible concerns? Number one, the most common concern that the patient will have is would be the disturbance with the sleep. Okay, they would be presenting with insomnia. Okay, and that is the most common presentation of abuse, and the presentation by which the patient comes to you, that okay, I'm unable to sleep, I'm having difficulty in sleeping, my sleep is being disturbed. Okay, and they may just be asking for sleeping pills. Okay, so their concern may be that doctor, I need a sleeping pill, can you just prescribe me a sleeping pill? And then when you ask them that why exactly do you need a sleeping pill, and they're going to say, doctor, yeah, I've got some difficulty in sleeping, and I've got some sleeping issues, I've got some sleeping problems, and I'm unable to sleep, so that's why I want sleeping pill. Okay, so the problem may be related to the sleep issue. Okay, and there is another variant in which the patient may just present to you, with the complaint of palpitations. Okay, so they may just say that, doctor, I've been experiencing a racing heart, I've been experiencing some abnormal heartbeats, I feel that my heart is going to stop, I feel that I'm going to die, and I'm having a lot of anxiety, and my heart keeps on pounding in my chest. So that may also be a presenting complaint. Okay, and they may just come to you asking for a sick note, that, doctor, I just don't feel well, I don't just feel all right, and could you please just give me a sick note, so that I don't have to go to work, so that I can take an off from my workplace, and I can just stay at home, and make sure that I am completely fine. Okay, so they're going to ask for the sick note, and when you ask them that, okay, why do you want a sick note, they would just say that I don't feel well, and I don't just feel all right. Okay, and whenever you're going to inquire about the presenting complaint, or inquire about the concern, like, okay, can you please tell me since how long have you not been able to sleep, since how long have you been having sleeping problems, are you having difficulty in sleeping, are you having difficulty in maintaining your sleep, are you having difficulty in waking up, can you please tell me more about your palpitations, since when it has been happening, do you feel any chest pain with it, do you have any shortness of breath associated with it, does anything make your palpitation better, do you feel that it gets better when you take a rest. Okay, so you're going to ask all of these things. Okay, and about the sick note, you're going to explore that, okay, why do you need a sick note, what exactly you're going through, can you tell me what do you mean by the fact that you're not feeling all right, what do you mean that you don't feel well, can you please elaborate on it. Okay, and then when you say all of these things, this is where the patient would be giving the non-verbal clues. Okay, and we have talked about the non-verbal clues in a lot of detail, and we discussed that what are the non-verbal clues. It's there in the psychiatry category, and I talked about it, that whenever the patient is uncomfortable, they would say, or they would portray their body language in a way that would tell that, okay, they are not very comfortable in having this conversation, they are not very comfortable right now, and what they might be doing is that they may not be making eye contact. Okay, they would have a very defensive posture, and they may be just sitting like this. Okay, and their head would be down, There wouldn't be any eye contact. They would be very shy, and they may just be playing with their hands, okay, and they may just be looking here and there, like around the room, and not making any eye contact with the doctor or with you. And you would be able to sense these non-verbal clues in the way that they're speaking as well. They may not be able to very confidently talk about their issue. They may not be able to very confidently speak up, and they would have a very very low tone that, yeah doctor, I just don't feel well, doctor. Yeah, something is I'm not all right. Just give me the sleeping pills, doctor. Just doctor, help me with my sleep. I'm completely all right. I will be fine. Okay, so like this, okay, they would be acting like this, okay, and you could see that, okay, their tone and their voice, it may be shaking as well. Okay, if they are extremely traumatized by the abuse, they you may find that, okay, their voice is a bit shaky, and they whatever has happened has had a very severe impact on their mental health and on their mental well-being. Okay, so you need to be able to pick up the non-verbal clue of the patient, that okay, he or she is not doing all right, and we have talked about it, so I'll just review it for you. That after you've picked up the non-verbal clue, then what you're going to do is that you're going to uh, make sure that you provide the patient with a safe space, and make sure that you ask them to open up. And how are you going to do that? You're going to do that in a way that, okay, I can understand that you're not being very comfortable. I can understand and I can see that you're not being yourself right now. I can see that something is bothering you right now, Mr. Adam or Miss Anna, whatever the name of the patient is. Let me tell you, this is a very safe space, and if you just share your concerns with me, I'm going to help you in the best way I can. I am here with you, the NHS is here with you, all of us are here with you, and we are going to help you in the best way we can, in any way we can. Okay, but for that I would really want you to be very comfortable, and try to share what happened with you, and try to tell me what is wrong with you, so that I am able to help you in a better way. Okay, and then again, they may just show some reluctancy and some hesitancy, that no, no doctor, I don't want to talk about things, and I've already been through a lot, and I don't want to like get into the further details of it. And then you can just offer the confidentiality, that okay, whatever we discuss over here would remain between you and the medical team, and I'm going to help you in this regard. Okay, so this is how you're going to make sure that the patient becomes comfortable and becomes like comes to a point that, okay, they feel safe and they feel heard and they feel supportive, and they're able to open up and share their concerns, that yes, something has happened. And they may just say that, yeah doctor, I've been facing a lot of issues with my husband. I've been facing a lot of issues with my boss. My boss has sexually abused me. My husband is physically abusing me. I am being under the influence of domestic abuse. Okay, my husband comes home after getting drunk, and then he beats the shit out of me. Okay, so of course they're not going to say the shit out of me, but yeah, they're going to say that they beat me up. Okay, they're just going to like tell, and they're going to open up in this stage only. Okay, but you need to make sure that you identify the non-verbal clues, and you make them open up in the best way possible, and the way that uh, you know gives them the idea that, okay, they are being heard, they are being supported, and this is a safe space for them to open up. Okay, yeah. And now once they open up, then you can move to the layer number two. And since this is a very very sensitive matter, and this is something which you need to deal very sensitively as well. You cannot just directly start asking the questions, and you cannot just directly jump onto the data gathering. Okay, you need to do some signposting, and you need to show a very 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 good IPS skills over here. Okay, and you're going to signpost that, I'm really sorry that I'm asking you to recall all of this. Nobody wants to go through, and nobody wants to recall and say what has happened, but I'm really sorry, this is really important for my consultation. So will it be okay if you can answer a few questions for me? I understand that this is not the best thing to do, that I'm making you recall that particular incident. I'm going to, or I'm asking you to, go through all of those thoughts again, which I'm pretty sure that you must be trying to forget. But it is really important for my consultation. So will it be okay if we can have a chat regarding it? Okay. So do that signposting, give that support, okay, and try to give that image, and try to show that okay, this is a safe space, and you genuinely feel for the patient, okay, and you cannot just act it out, okay. If you're just trying to act out the sympathy, you would not be able to give the impression that okay, you are feeling bad about it, okay, you are you are having some sympathy about the situation, okay. So try to make sure that you actually feel that yeah, yes, something has happened and they might be going through a lot, okay. Try to internalize that thing, okay, and then only you would be able to do it in the most natural way possible, okay. And this is what is required in the abuse station, and you need to have those kind of emotions, and you need to have those kind of tone that gives that impression that yes, he or she also feels bad about it, genuinely feels bad about it, okay. So yeah, after doing the signposting, okay, then you explore the abuse, okay, and this is what the major data gathering would be, okay. And then you're going to start off that what happened, how it happened, who did it, has this type of thing has happened, has it happened before, uh, any particular reason why they might be doing it. So they can just give you the reasons that yeah, doctor, my husband lost his job, yeah, doctor, my boss, he usually sexually abuses different females out there, or maybe you can they can just say that because my husband is a chronic alcoholic, my husband takes IV drugs, or my partner takes IV drugs, and that is why they abuse me, okay. So they may just give you some reason that why it is happening. So just what happened, how it happened, who did it, has it happened before, and any particular idea why it happened. So what, why, when, and how of the entire situation, okay. That is the very first thing that you're going to do, okay. And then you're going to explore what type of abuse was it, okay. Was it a verbal abuse, was it an emotional abuse, was it a physical abuse, okay. Forget about the font. Yeah, was it a verbal abuse, was it emotional, physical, or were you sexually abused, okay. So you're going to ask about all the type of abuses, okay, and name all of them, okay, because somebody may just present to you with the complaint of sexual abuse, okay, but they may be verbally, or they may be emotionally also being abused at a workplace, okay. Or if the husband is doing physical abuse, okay, and that is what the complaint is, and that is what their concern is, that particular patient may also be sexually abused by the partner, okay. So just try to explore all the type of possible abuses that can be there, okay. And if it's a sexual abuse, okay, then you need to ask a few intrusive questions, and again try to signpost over here that I'm really sorry for the intrusive nature of my question, but can you please tell me that was the sexual abuse or was the rape that happened, was it just done by one person, or were there multiple people involved, okay. What was the route that was used, was it oral sex, was it vaginal sex, was it anal sex, okay. And this question is typically and particularly for the sexual abuse cases, okay. Then you got to ask that whether or not it is happening under the influence of alcohol or drugs. Important question, because this is one of the risk factors of abuses. The abusers who are under the influence of alcohol and who are under the influence of drugs, they tend to abuse the patient, abuse the partner, or abuse the victim more as compared to someone who is not under the influence of alcohol and drug. So it is an important question that you need to ask, okay. Then very essential question, very essential question, that do you feel safe at your home and at your workplace, okay, wherever the abuse is happening. And why is this question important? Because when you come to the management and when you are discussing the management, okay, your management would really depend on the answer to this question, okay. Whether or not you need to admit the patient. Let's say that there is nothing medically wrong, okay, there is no admission criteria, no other admission criteria that is being fulfilled, okay, but the patient says that I do not feel safe at my workplace, I do not feel safe at my home, I feel that my life is in danger, I feel that if I don't take any actions, and if I don't, just leave that particular place, I would eventually be killed. Okay, so if they say yes to this question, then it's fine. Okay, like that means that okay, the extent of the abuse is not that much, or to a point that okay, you need to admit the patient for their safety. But if they say yes, and know that they don't feel safe at their home and they don't feel safe at their workplace, then that means there is a problem. Okay, and you need to admit this patient, not because of the on the medical grounds, not even because of the psychiatric grounds. Okay, but on the grounds of the safety, because you are concerned about the safety of the patient, that if you let the patient go home right now, there is a very strong possibility that they may just get harmed. Okay, then another very very essential question, okay, that is, are there any kids at home? Okay, this is a really really important question. Okay, why? Because let's suppose if a mother is being abused in front of a kid, okay, that is basically a red flag. Okay, and that requires immediate involvement of the social services. Let me tell you why. Because if even if the child is not being abused, okay, if the abuse is being happening in front of a child, the kind of impression and the kind of damage it is doing to the mental health, and the kind of memories that particular incident is inbuilting in the mind or in the brain of the kid, that is not all right. Okay, there is a very strong possibility that just because of this, the child may develop mental illnesses. Okay, the child may develop childhood anxiety, they may develop PTSD in the future, and the child may have a very 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 significant effect on the mental health. Okay, so, and another very important thing, the abuser may just eventually start abusing the kid as well. Okay, so if there are any kids at home, it is like really really essential that you involve the social services. Okay, because you need to think about the safety of the kid. Okay, and very important question. So these two questions, your management would heavily depend on these two questions. If you don't ask them, if you miss out on these two questions in your data gathering, then of course you're going to lose marks on your data gathering, and eventually you're going to lose marks on your management as well. Okay, so very important questions that need to be asked. Then you can ask that, is there anyone else at home or anyone else at the workplace who is getting the same treatment? You need to think about the safety of others as well. If they are abusing more people, then they are more dangerous. Okay, then that means that more than one life is at stake. Okay, more than one life is in danger. Okay, so now you need to do much more aggressive management, and you would have to request this particular patient to um, go and talk to the other people who are being abused, and request them to open up, and request them to come to you, and also request them to take the legal action, and take the necessary steps that are important to prevent this type of things happening. Okay, so yeah, you see, all of these questions are like really really important, and you need to have these questions in your mind, and you need to always ask these questions whenever you are dealing with an abuse case. Okay, really important aspect of the data gathering. Now, let's move on to the layer number three. Okay, that is the psychosocial. Okay, and since it's a case in which mental health is usually like definitely affected, and a lot of psychosocial aspect is involved, you need to ask a few questions. Okay, that, do you have friends and family members? You got to assess the support, that okay, do they have anyone to talk to? Okay, have they shared it with anyone? Okay, um, uh, is there anyone there out there to look out for them? Okay, then did you talk to someone about it? Have you shared this thing with anyone else? Are there more people who are aware about it? Okay, then did you talk to your employer about it? Okay, ask this question in the case of workplace harassment only. Okay, then these are the two questions here, they're like really really important. Like, are you financially dependent on the person who abused you? Okay, why? Because again, if somebody is financially dependent on the abuser, it would be very difficult for them to take legal actions against them. They would be thinking about a lot of things, that okay, who is going to take care of my finances, who is going to uh, you know take care of my needs, and if I leave this particular person, then I would become homeless, I wouldn't have a place to live, nobody would be there to pay my bills, because I'm financially dependent on this particular person. Okay, And this question is like really important. Why? Because in cases in which the abuser financially provides for the victim, okay, in those cases you would have to eventually refer the patient to the Citizen Advisory Bureau, which is basically a service that is provided by the UK, in which they provide financial assistance, they provide housing support and accommodation support to the people who cannot afford it and the people who actually need it. Okay, so on the basis of this question, you are going to see whether or not you need to involve the Citizen Advisory Bureau, or would you need to refer the patient to the Citizen Advisory Bureau or not. Okay, then who has your passport? This is like really really important. Why? Because often abusers, they hold their passport so that they are unable to run, they are unable to leave the country, they are unable to leave the city. And why is this question important? Because there is a very strong possibility that the victim who comes to you in your GP surgery or in the A&E, they may be an immigrant. Okay, like for example, a young female moved from Germany to the UK for a job, and then she may just be abused, and she may not have anyone in the UK, no family, no friends, and she must be completely new because she just joined a job, and she just joined a new company, and now she's starting to getting abused. And on the name of legal and paperwork, the boss must have like taken her passport. So you cannot just suggest her to go back and go back to your family and try to talk to them and then get the support from them in your home country. Okay, you can't even suggest this to this patient, and you cannot ask them to take a break or go out on a vacation, go to a different country. You would not be able to suggest these like options when it comes to the management part. So you need to ask that who has your passport. By any chance, has the abuser taken your passport, or is it in their custody? Okay, because if that is the case, then she would have to, or he would have to take the legal steps and make sure that they retrieve their passport back. Okay, so yeah, a lot of questions of the psychosocial aspect. Then the psychiatric specific history. How's your mood on a scale of 1 to 10? Have you ever had thought of self-harm? Do you listen or see things that are not actually present? Okay, and you can ask about a couple of more questions. How is your sleep? Are you able to concentrate on your work or not? Okay, and this is not exactly the psych specific history, I would say. uh, this is something that you can ask in the psychosocial aspect as well, that how is your sleep and are you able to uh, concentrate on your work. But the psych specific history, that there are three things: mood, self-harm, and hallucinations. Okay, so you need to ask about it. Why? Because there is a very strong possibility, and that they may just be having some thoughts of self-harm, and their mood can be very low on a scale of 1 to 10. Okay, and because of this severe mental distress, they may just be experiencing hallucinations as well. Okay, and in either of these cases, if any answer is yes, low mood, thoughts of self-harm, and having hallucination, then you would definitely have to admit the patient. Okay, so these are the set of questions that are also really really important. Okay, and this is why the abuse sessions get difficult, because you see there are so many different things, so many different questions, and it's not very simple and straightforward. In the beginning, the presenting complaint would be something else, and then there would be the non-verbal clues, and then you would have to be very nice and supportive to make sure that they open up to the non-verbal clues. And once they are done with that, and then you start your data gathering. Okay, so you would not even have enough time. Okay, you would not have enough time on the clock to like ask each and every question. Okay, and at that moment, if you're just thinking, okay, now what should I ask or what should I not ask? Okay, is this question important, is this question relevant? Then there is a very strong possibility that the 8 minute would just pass away, and you wouldn't be able to come to the management part. Okay, that is why you should be aware of all the questions, you should be aware of all the categories, you should be aware of all the layers, and you should know that, okay, what to ask, when to ask, and how to ask. Okay, and practice it a lot. Okay, because lots and lots of different questions, lots of data gathering, and all of them are like really important, and you have a time crunch involved. Okay, so yeah, in the layer number 4, you ask about the psychiatric history. Okay, now layer number 5. that is explanation. And you need to explain, and then you need to provide some more sympathy. That Okay, Miss Anna, thank you so much for opening up. I really appreciate the fact that you talked about it. I do understand that it's not easy to talk about incident. It's not easy to recall such incident, but I really, really appreciate your bravery and your courage to open up and talk about it to me. Whatever you're going through, this is an abuse, and let me tell you, Miss Anna, that this is a criminal offense and this is not at all accepted. uh, and there is a very strong possibility, because the people who go through it, they often tend to blame themselves. But I would like to tell you that this is not your fault at all, and this is something that is you did not deserve to go through it. Nobody deserves to go through what you went through. There are a couple of things that I would like to talk about. Would you like to listen? What are the options that you have? Like, yes, we are there at your support, but there are a few things that you can do for yourself as well. So would you like me to share all of those things? Okay. Why is this important? Because she was here or he was here just to get a sleeping pill, and they did not want solutions at the very first place. Okay. But it's your job to offer the solution, and you just need to ask that whether or not it's okay, whether or not they are able to they are ready to listen to those solutions or not. Okay. So just ask them, okay, will it be okay if I can just talk to you about some solutions that you can follow? All right. And then they would just nod the head and they would say, yeah, doctor, please tell me about it. Okay. Then what are the referrals that you need to make? Okay. The one stop solution, okay, for the sexual abuse and the rape victims, okay, it's called the SARC. Okay, that is sexual assault referral center. Okay, I'll just share it with you that this is an NHS supported service which provides confidentiality, medical care, forensic examination, emotional support. Okay, and they also have the option of legal services and police involvement if it is necessary as well. Okay. So you need to tell about the SARC. Okay. And how are you going to talk about the SARC? You're going to say that okay, I would like to refer you to the SARC, which is the Sexual Assault and Referral Clinic. It is a one-stop solution for all the victims who have gone through sexual abuse and rape. uh, so what they would do is that over there there would be some healthcare professionals who are going to provide you with the medical support. They're going to run some tests. They're going to check you for sexually transmitted infections, and they're going to see that if there is any mark of injury or any possibility of injuries, and they're going to treat you regarding that. Okay. Other than that, there are psychologists and the psychosocial therapists who are going to have a conversation with you and who are going to have a chat with you, so that they can provide you with some mental health support and you can talk about it and feel a bit better after taking some talking therapies. Other than that, there is a legal firm and legal angle involved as well. So what you can do is that you can register the complaint whenever you want to. Okay. You can register the complaint, you can register the name, and you can tell the details, and they would not take any action. Okay, because they're really afraid that I don't want to take action. They don't want to take action. I don't want to take a step forward. I don't want to get into the hassle. I just want to ignore it. Okay, so what you can say that, okay, you can just provide the details and you can just make the written formal complaints, but we would not take any action, or the SARC would not take any action until you approve. Okay. Until you approve, or until you request us to take any legal action. And over here it is like really, really important that do not force the patient to take legal action. Okay. And this is the problem. I talked about it in the non-accidental injury as well, that we start becoming a lawyer. Okay. We are not lawyers, and we are not supposed to force the patient to take any legal actions. The people of the abuse group, okay, they have the mental capacity. Okay. They are above the age in which they can take their own decisions. Okay. So just talk about the solution and do not force them that no, you should take legal action, you should take this person to court, you should talk to the police about it. This is not at all acceptable. Yes, this is not at all acceptable, but you're no one to force them to take legal action. You're just supposed to talk about the legal options. You're just supposed to talk about the options that the patient have. Okay. And do not force them to take any legal action. You can just say, just register the complaint. We're not going to take any legal action until you ask us to. Okay. So that is what the sarc does. Okay. And then you can if it's not the sexual abuse, then you can refer the patient to CBT for talking therapies, where they'll be seen by the psychosocial therapist or the psychologist, and they're going to talk about it, so that they feel better, and they start thinking about the situation in a much more rational way. Okay. Then you need to keep an eye when you need to admit. Okay, I talked about it, I'll just repeat it, that if there is a life threatening condition involved. Okay. And what are the life threatening condition? If the abuser is causing harm to the baby or to the person. Okay. And if they don't feel safe at home or safe at workplace, because they may have attempted to harm them, number one. Number two, a physical violence or of abuse that is very very violent. Like for example, when you're exploring the abuse, that how it happened, and if they say that, yeah doctor, he often throws a heavy chair on my head, that is something which is very very violent, that is something which is life threatening. Yeah doctor, he often throw knives at me. Okay. Or he tried to once cut my hand. Or doctor, yeah, he often he tried to just push me down the stairs. Okay. So there can be a very very risk, very very high risk of the patient eventually dying. Okay. Sometimes a pregnant lady might also be experiencing abuse, because the child that she would be bearing would be unplanned. Okay. And you need to make sure that the baby is not in any harm. Okay. If the abuser is trying to harm the baby, if the abuser is trying to kill the baby by hitting the patient, the woman on their womb, and trying to attempt to harm the baby that has not even come to life, even then it's a life threatening condition, because the life is at risk, and you need to admit the patient. Okay. And that other criterias of admission, that if there is a suicidal tendency. Okay. And if there is a risk of self harm. Okay. And if there is a low mood, then you need to admit the patient. Okay. So all of those criteria, if there is a psychiatric aspect, if there is a life threatening aspect, or if there is a medical aspect, okay, involved, then always admit the patient, always offer admission to the patient. Okay. And try to convince them this is for your safety, and we got to make sure that everything is all right with you, and we got to make sure that everything is all right with the baby, and your life is not at risk. Okay. So those are the referrals that you need to do. Now the other layer, now let's just move on to the layer number 7, in which you need to talk about the legal options. Okay. And what are the legal options, and what are the other options that you can suggest to the patient. Okay. That is number one, the National Domestic Abuse Helpline. Okay. And it is a helpline that is there. It is an service that is provided by the UK government, in which people can who are undergoing domestic abuse, they can call, and they can talk, they can seek help, they can seek advice, they can also seek safety if they feel that, okay, their life is at risk, and they just need to call someone if they're going through a lot of mental stress, depressive episodes, thoughts of self-harm because of an abuse. Okay. Then they can call the National Domestic Abuse Helpline. Okay. So yeah, emotional support, safety planning, legal guidance. Okay. Referral to shelter and specialist service. Okay. It's a 24/7 service that is provided to them, to make sure that the domestic abuse victims are safe and they are heard. Okay. Then there is a police line, of course, it's a abuse case, they can always go to the police, they can always go to the legal authorities. Okay. So suggest about the police line. Then if somebody is experiencing workplace harassment, and they work in a good company, they work in a big company, they work in a multinational company, ask them, advise them to go to the HR, try to fill in a safe disclosure against the abuser, try to go and talk to the boss, if the boss is not the abuser. Okay. Try to talk to other senior management of your company, try to approach the disciplinary committee. Like good companies, they do have a disciplinary committee, they do have a feedback or a complaint form that are available. So you need to talk about these options as well. Okay. uh, so work related options that are there in case of the workplace harassment. Then the crisis line, that we've talked about in the psychiatry station, that if they are experiencing any mental health illnesses, okay, they need to they can call the crisis line or the crisis home resolution team, which can come and help them with their mental health issues. Okay. And then I talked about it, social services. Okay, you need to involve the social services if the child is at home and if the abuse is being happening in front of a child. Okay, so yeah, along with the referrals, okay, don't just like think that, okay, I've just referred the patient, now my job is over, now I don't need to do anything. Suggest other options. Okay, you need to provide a holistic and a complete solution to the patient. Okay, it's up to them whether or not they follow it or not, but it's your job to provide all the legal options, all the options that that can be provided to a patient, or to a person that who is undergoing any form of abuses. Okay, so yeah, and then the layer number 8 is the medical management. Okay, because the presenting complaint, you don't need to forget about it, that they initially presented with either insomnia or palpitation, or they might be asking for a sick note. Okay, so in case of insomnia, you can give benzodiazepines. Okay, that is what your medical management is. If somebody is going through abuse, and if they are having insomnia, do give benzodiazepines for insomnia. Okay, if they're having palpitations and anxiety, you can prescribe them with beta blockers. Okay, and if they don't have either of these things, and if they just want a sick note, if they want to take a break from their workplace, just to feel safe, just to think about the possible options that they have, then you can always provide a sick note as well. Okay, so agree to these demands in an abuse patient. Okay, you can give a sick note, because yes, the patient is mentally sick. Okay, the patient is going through a lot mentally as well. Okay, and make sure that you are providing these medical management, because what a lot of people do is that they're so focused on the legal options and the referrals, okay, that they completely forget that they are also a doctor at the end of the day, and they need to do the medical management, and they need to medically manage the patient as well. Okay, so do not forget about this, do not miss out on the medical management part. Okay, so yeah, and when to admit. Okay, I've already talked about it. Okay, so yeah, this is what you need to do in abuse, and this is what you need to follow, and this is the structure that is needed in the abuse cases. Okay, and as I said, that it can be challenging because of the non-verbal clues, because of the extensive data gathering that is needs to be done. Other than that, the patient or the simulator would be taking a lot of time in answering your questions. Okay, they would be speaking very very slowly, and they would be taking time, they would be taking silent pauses. Okay, so that would further kill your time, and then you have to manage the patient ethically. You need to make the right referrals, you need to give ethical solutions, and then at the same time, you cannot forget that you are a doctor, and you need to manage the patient medically as well. Okay, so there is a lot to do, there is a lot to do in this type of stations. Okay, and that is the reason why I have discussed it in so much detail, so that that you're doing it right. Okay, because you don't have the option of doing it wrong and then eventually making it correct later on in the station, because you don't have that much time. A lot of candidates, they are not even able to make them open up from the non-verbal clues. They just spend 5 minutes of their time and 5 minutes of their consultation in requesting them to open up, but the patient wouldn't open up, because they're not making them open up in the right way, they're not being supportive enough, they're not following the right way to make the patient open up. Okay, so try to make sure that you keep every foot right. Okay, and there is a very 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 low margin of error, because your data gathering is so intense, your management is so intense, and at the same time, since this is a domestic abuse or this is an abuse case, your IPS also needs to be of the highest level. So it is a difficult station to master. It is a difficult thing to prepare. So you make sure that you have gone through the structure, you have watch this video again if it's needed, and make sure that this structure and all these questions are hardwired in your brain, they're ingrained in your brain, so that you don't mess up on the exam day. Okay, so that's pretty much it from my side. If you got any questions and any queries, drop them down in the comment box or drop them down on the socials. I would love to address all your concerns, and if you want a one-on-one mock, then scan the QR code, and my team is going to contact you after you've registered for the mock. That's pretty much it. See you in the next lecture.